come to fruition. But with the Hazur's prayers and his attention, we are now able to see the effect of these prayers.
You should continue to discharge your responsibility by contributing as much as possible towards this project.
In the heart of Ivory Coast, a vision began. A vision to bring quality healthcare closer to communities where access to care is still a challenge. In 2018, the groundwork started. Land was cleared, foundations were laid, and hope began to rise brick by brick. Over the years, that vision continued to grow. Walls were built, structures took shape. A hospital began emerging in Yopougon Gesco near Abidjan. Dignity, building more than a hospital. It is about building dignity, building access, building hope. And on May 10, 2026, the world comes together live from Ivory Coast for the Humanity First Global Telethon 2026. Because healthcare should never depend on geography.
In Ivory Coast, many low-income families struggle to access quality healthcare services.
Assalamu alaikum wa rahmatullahi wa barakatuhu. May the peace and blessings of God be upon you. Welcome to Humanity First 2026 Telethon. I am joined here with my co-host Fazl Ahmed, and as is customary, let us first begin with a silent prayer. Would you lead us there in that, Fazl Sahib?
Sure. Please join me for silent prayer. Ameen. So this afternoon is focused on our new Humanity First Hospital in Yopougon Gesco in Ivory Coast. In a few minutes, we will be joining our team live in Ivory Coast from the hospital, and through this afternoon, they will be showing you different parts of the hospital facility and bring it to life for you. Before we do that, let's go to Dr. Shabir Sab, who is our Vice Chairman International and has been central to this project for many years. Dr. Shabir Sab?
Very nice to be here. Can you not hear me? Okay. Well, yes, very nice to be here.
Around this project. So I was hoping maybe you can tell us a little bit about when this project first started.
The project actually started around 2014, 15, 13, some. We're not 100% sure, but it started off with the Ahmadiyya Medical Muslim Association to build a state-of-the-art hospital in Abidjan. So when they started building this hospital, Hazur Ayyadatullah bin Nasr al-Aziz intervened by saying that it is quite out of your depth, and you better give it to Humanity First International to build it for you. But do not abandon all responsibility you have towards the building and managing the hospital. So in real terms, we took over the hospital from around 2017, I think. There was a planning stage, there was architectural phases and all sorts of things. So then it started off in real with real gusto around the 2020 mark, and that's when we started really in full swing. The hospital started to get built.
I was just speaking with Fazil about this project, and one of the things that I found was really fascinating, especially these days with all of this talk about sustainability. And Fazil shared with me, and one of the things that as I've been following this project for the last 10 years or so, one of the things that I find so amazing about this project is that it was initiated under the concept of building a sustainable model. And I'm hoping maybe you can tell us about what makes this project so centered and grounded in sustainability.
Been modeled on an already successful example here, which is the Nasser Hospital in Guatemala, and that also had a history that it was initiated from a government source, and Huzur agreed for them. And I think with Abidjan, it is similar story as well. So we've had a model where the sustainability issue or the concept of sustainability has worked with the proviso that all money invested or rather recouped from the project would go back into the project. And Hazur directed Humanity First International that's exactly what we have to do as well. We will sustain the model by serving the well-to-do, and from the profits there too, we'll try to hopefully help the people who are unable to manage their health costs. But we will still make a profit because, as the example in Guatemala tells us, that profit is made despite all that. And that is then plowed back into the society or into the country. And Hazur's clear instruction is that not a penny of what we have made from this hospital will go out of the hospital.
Fazil, maybe you can give us a little bit more background.
So if you look at healthcare in Ivory Coast, in fact, when we first started looking at this hospital, it was with our local team. We went to Abobo, which is one of the poorer suburbs. It's like a shanty town on the outskirts of Abidjan, and there had been a huge influx of patients coming in, and they didn't have the means, and because they were congested and without the infrastructure, we were starting to see youth with cardiac conditions. We were starting to see women really struggle with childbirth. In Ivory Coast, on average, 4 out of every 1,000 births, the mother will die. And then out of the children that are born, 3% of the babies won't even make their first month. And so these are numbers that we wouldn't accept in Europe. And so one of the key focuses for this new hospital is maternal and child health, maternal and neonatal health. And we want to, the location, as you will see in a few minutes, and the quality of the facilities is to attract high quality staff and to attract high quality patients so that we can then use the surplus income to subsidize patients from places like Abobo or the new suburbs north of Yopougon heading towards Yamoussoukro, where people don't have insurance and can't afford the care. So I think we're going to go over to our Ivory Coast team in a minute's time, and then through this afternoon we'll be showing different aspects of the hospital facility, and also you will be seeing some of the team that are going to be involved in the long term in the running of the hospital. We need the donors' help to operationalize in the next 3 months, and that's where we need our donors to now make one final push for us, and you'll be showing them through this afternoon how they can help.
Well, we'll be showing them. And I think what you've said that really struck a chord with me is how important it is for us to remain involved, remain supporting this project. I can remember when I was a kid and I would pass through, and this is just in New York, so many of you can just appreciate what it's like in Western countries. But many of us would not be surprised to see many poverty-stricken areas, even in Western countries. And so you can imagine being able to be in a position where you can be part of such a blessed project. I mean, imagine being able to tell your children or your grandchildren or even your parents or your siblings or friends that, yes, this amazing hospital that is there in Ivory Coast, in Cote d'Ivoire. I was a part of supporting that.
I think they're ready for us now on Ivory Coast. So
Assalamu alaikum. Jazakallah Fazal Sahib and Hamza Sahib. We are here live at the Masroor Center for Healthcare, a hospital in Yopougon near Abidjan in Cote d'Ivoire. We will be starting with the recitation of the Holy Quran by Hafiz Saeed.
Assalamu alaikum wa rahmatullahi wa barakatuh. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. ليس البر أن تولوا وجوهكم قبل المشرق والمغرب ولكن البر من آمن بالله واليوم الآخر والملائكة والكتاب والنبيين وآتى المال على حبه ذوي القربى واليتامى والمساكين وابن السبيل والسائلين وفي الرقاب وأقام الصلاة وآتى الزكاة والموفون بعهدهم إذا عاهدوا والصابرين في البأساء والضراء وحين البأس أولئك الذين صدقوا وأولئك هم المتقون. Translation. In the name of Allah, the gracious, the merciful. It is not righteousness that you turn your faces to the east or the west. But truly righteous is he who believes in Allah in the last day, and the angels, and the book, and the prophets, and spends his money for love of him, on the kindred, and the orphans, and the needy, and the wayfaring, and those who ask for charity, and for ransom the captive, and who observes prayer, and pays the zakats, and those who fulfill their promise when they have made one, and the patient in poverty and afflictions, and they stay fast in time of war. It is this who have proved truthful, and it is this who are the God-fearing. Holy Quran chapter 2, verse 178. Assalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallah, Hafiz Saeed Sahib. And now we will have welcome remarks by Amir Saab, Cote d'Ivoire, Abdul Qayyum Pasha Sahib, and dua.
वरहमतुल्लाहि वबरकातुहू। अब हम दुआ में शामिल होते हैं ह्यूमैनिटी फर्स्ट के तमाम कौमों के लिए जो इंसानियत की खिदमत कर रही है, और उन तमाम शामिलीन के लिए भी जो ह्यूमैनिटी फर्स्ट की खिदमत कर रहे हैं, और उनके साथ मिलकर ह्यूमैनिटी फर्स्ट अपने तमाम प्रोजेक्ट को पूरी दुनिया में और ख़ास तौर पर अफ्रीका में चला रही है। दुआ कर लें। आमीन।
Jazakallah, Amir Saab. And since we are in a French-speaking country, Madame and Monsieur, bonjour. We have a few great guests in the audience here with us at the hospital today. We have Dr. Ahmed Koulibaly. We have Chairman of Humanity First, Cote d'Ivoire, Yahya Saib. Welcome, welcome, and many other Marabiyan and others joining us today as we go live. Since we're here today, I'd like to turn first to Munam Naeem Saib, who is the Chairman Humanity First USA. And folks are perhaps a little curious. Dr. Shabir Bhatti shared a little bit in terms of context, but help me understand, how did Humanity First USA through Humanity First Healthcare USA and Humanity First Healthcare International start the work in not only working at a hospital, but also the construction and operationalizing a hospital?
Okay, first of all, Assalamu alaikum wa rahmatullahi wa barakatuh, and greetings of peace to all of you. So Mac, obviously this project or this initiative is the initiative of Humanity First UK, Humanity First Canada, and Humanity First International. So your question is very valid why HF USA is here, right? I think because just we love it. No, it's not the only reason.
Interesting. Hamza Ilyas Saab is from New York. You formerly lived in New York. I currently live in New York. There's a pattern I'm seeing, but go ahead. Tell us the real answer.
So the real answer is that one is the HFI, out of our past experience, we were the first one to establish Humanity First Healthcare Services under the leadership of Majid Khan Saab. And
this was in Guatemala?
This was in the Guatemala at the initiation of that hospital. And that organization is growing, and perhaps you will speak to Majid Saab in more details, right? So we had a very success story about running HF Healthcare Services and running a successful hospital. And so HFI gave that contract to HF USA to Healthcare Services. So Healthcare Services USA got the operating contract to run it on behalf of HF International, HF Canada, HF UK.
That makes sense. Help me understand a little bit about the work that went into setting up the Guatemala hospital. There's a lot of fundraising done, but also a lot of architecting and building a great institution that's world class.
Yes, I think we will have a lot more detailed discussion in next session. We will talk about it. But, it started out back in 2015 with a request from local Guatemala government authorities to Hazrat Khalifatul Masih coming in that the healthcare system was very poor and we needed to start one. And in that process, we found Majid Saab, who had experience in building hospitals. Right. And that's where the story came in. That's where this entity was also born because of that, because we wanted to protect ourselves. And so I think that's the story we will say.
With that, let me transition to Majid Khan Saab, Captain Majid Khan Saab, who you lived in the US. You were asked to actually come in and construct the Guatemala hospital and then manage it. Have a team of medical professionals, medical directors who we'll talk to in a minute. But can you give us a quick history on how that was built and the context you learned to come here to Cote d'Ivoire?
Assalamu alaikum, Jazakallah, and Jazakallah for all of you to come over. You have come from, all of you have come from USA, and there are some very important and distinguished guests sitting here. Jazakallah, thank you so much. It all started with a phone call from Monem Saab. That was, if I recall, May of 2015. That was like 11 years ago from today. And then, of course, we thought of a plan how effective and sustainable project can be put together in Guatemala. And after a couple of months of planning, we were ready to lay the foundation, and rest is history. The highlight of that project is, of course, there is no other Humanity First project where Khalifatul Masih himself came and traveled and inaugurated the hospital. And that gave us a huge push, motivated us, and we were just ready to launch probably the most successful Humanity First project of any kind, anywhere in the world.
Help me understand a few things you learned from that as you transition to coming to manage Masroor Healthcare Clinic.
The learning process actually started with Fazl Umar Hospital and Thair Heart Institute. That is, Thair Heart is still my first love. So from there on, obviously Nasser Hospital.
That is in Pakistan.
That is in Pakistan, yes. Nasser Hospital comparatively was a smaller project, but in an alien country, different challenges. So given that experience of working in an alien country, honestly, when I was told when Monem Saab called me, the first thing I did was to look up Guatemala on the map, because I had never heard of that country. And then, of course, after that, that experience of working with, in an alien country has really helped in putting Masroor Center for Healthcare the way you will see today.
That's really helpful, and we'll talk about where we are and what you've done here in a minute. But Dr. Fahim Ahmed Saib, there's the operational element of this, and then there's the great medical care element of this. What have you learned? And I know you practice a large healthcare practice and with multiple hospitals in the Chicago area of USA. What have you learned in Guatemala that brings us here today?
So as I'll just build on what Majid Saab said, I think once you make the hospital like we are seeing it here now, the bigger challenge is that we put in a healthcare product that is unique, is affordable and accessible, which actually means that we need to maintain a quality that people will come and trust. And for us to do that, I think the very important thing going hand in hand with the operations of the hospital is that we end up hiring the right people who follow the mission that we have. They have the same mission and they are qualified to do the job. The more important part in the hospital always is to follow very strict protocols. Munim Saab is sitting here. You cannot make mistakes. You're dealing with human lives. So as you follow and write those protocols, make sure that there are physicians and nurses and ancillary staff and OR staff who buy into that. So the very important part is that we select the right people.
As you've done that, you have American context. Some would argue the American healthcare has good standards. Let's assume that for a second. Is Guatemala and is the vision for here to be at those standards of service?
The goal is to be the best hospital as Cote d'Ivoire. That's the goal, and ultimately become a regional center for Africa. I was just talking to Ahmed Saab, who's a gastroenterologist here, and we would love to not transfer patients out. I was just on a phone call that we are going to transfer a patient from Benin for cardiac surgery to thyroid heart that you alluded, because that's where we have the capabilities. And I mentioned in that phone call, I said, what if we just have to transfer that patient within Africa to a regional center of excellence? And I truly think that as Nasser Hospital becomes the regional center of excellence for Central America, we should think of Masroor Health Center as a regional center of excellence for these kind of services, and people are coming to us for
Jazakallah. That's really good context, and we'll go deeper into that. So as I was sharing just a minute ago, we're in the region of Yopougon, which is about 20 to 30 minutes from Abidjan, which is not the capital of Cote d'Ivoire, but it's a bustling center, kind of like the Manhattan of Africa, as some would say, as well. So, and where the hospital is located it's in the major thoroughfare with all the Humanity First clinics in neighboring West African countries. So it's a very strategic location, and there's nearly 1 million people who live in the Yopougon area who can benefit from the services that Dr. Fahim Ahmed just talked about. What we're going to switch to now is a short video sharing the foundation stone laying ceremony and context of how this hospital came about, and which we are currently sitting in. We're almost done in building it, and we want your help as we build this out. And we'd love for everyone to participate, but learn from this experience, see how it came together. We'll transition to a short video.
In Ivory Coast, many low-income families struggle to access quality healthcare services such as maternity. Equally, there is insufficient capacity of local doctors, nurses, surgeons and anaesthetists to serve in the various hospital settings. Over recent years, the population of Abidjan in Canada and the UK are spearheading fundraising efforts to drive the construction and equipping of the hospital, and will need all the help they can get from our generous donors.
We seem to have
Equally, there is insufficient capacity of local doctors, nurses, surgeons and anaesthetists to serve in the various hospital settings. Over recent years, the population of Abidjan has grown rapidly, and there are pockets of poverty such as Abobo, where the population is underserved for healthcare. With the guidance and prayers of Hazrat Khalifatul Masih al-Khamis, may Allah be his helper, Humanity First started making plans for the Masroor Center for Healthcare. The search for a suitable site began in 2013, and eventually this location in Yopougon-Jesco to the northwest of Abidjan was chosen. The site is on the main highway leading out to Bouaké and is in a growing population area suitable to attract private patients. Building on the Nasser Hospital in Guatemala, which was launched in 2018, this centre will also look to attract private patients to then subsidise care for those who wouldn't be able to afford it. The centre will also help to train the next generation of clinicians in Ivory Coast, which will benefit the country and the region of West Africa, and work began on the design in 2017. Gradually, the ground was compacted in phases by 2020, ready for construction. Through 2021, a perimeter wall was built to mark the boundary of the site. Soil testing was conducted, and work began on the infrastructure for the hospital. In recent months, the design has been approved, and so we are ready to begin the build phase. And so it was on Saturday the 27th of November 2021 that our local Humanity First team in Ivory Coast were joined by senior colleagues from the UK, USA and Canada for the foundation stone ceremony. The stone itself was sourced from Guardian and blessed by Hazur, may Allah be his helper, before being placed at the foundations of the new hospital. Dr. Shabir Bhatti, the Vice Chairman of Humanity First International, attended as the representative of Hazrat Khalifatul Masih, may Allah be his helper. The teams in Canada and the UK are spearheading fundraising efforts to drive the construction and equipping of the hospital, and will need all the help they can get from our generous donors.
We seem to have at least reached a point where we think that Allah is now really going to help us. There was a time period when we were not sure whether this hospital will ever come to fruition. But with the Hazur's prayers and his attention, we are now able to see the effect of these prayers. We have laid the foundation stone, which looked so improbable just 1 year ago.
It's like a dream come true. This hospital will not only serve the local community, but we hope that it will go beyond and serve the whole country and even parts of the some of the neighboring countries. It is going to be a 30-bed facility to start with 4 basic specialties, and added on later with urology, cardiology and gastroenterology. It will be supported by a full diagnostic center and other services.
I'm very excited today. It is truly amazing to see the dream coming true with the first brick laid down today. Our Canadian donors are really excited to serve people of Ivory Coast through this state-of-the-art Masroor Center for Healthcare, with the guidance from Sayyidina Hazrat Khalifatul Masih al-Khamis Sayyid Allah bin Nasruddin, who has a special passion for and a special love for people of Africa. We are looking forward to a very high quality medical and surgical facility that will serve the people in this local population and in the nearby areas by very qualified medical professionals.
We are very blessed that this has taken place. Over the last 2 years we've been under the COVID cloud, but now is the real work going to start.
It has been a very unique occasion here to join everybody for the foundation stone laying of the Masroor Center for Healthcare. And I hope and pray that this center goes to fulfill the humanitarian healthcare needs for patients not only in the Yopougon area, but for people across Côte d'Ivoire.
Assalamu alaikum wa rahmatullah. Peace and blessings of God be upon you. Welcome back to us here in our London office. You know, Faza, I was really moved by seeing some of the footage there in Côte d'Ivoire, the Ivory Coast. And I was thinking to myself, oftentimes when you think maybe you've got a small ache in your knee or you've got maybe some pain in your tooth, whatever the case may be, you often think, whether or not you can be bothered to go to A&E. And so many of us have been in that position. No, I don't feel like going there. I'll stay home, or maybe I'll just go there. And I was thinking to myself, I can't imagine not actually having an opportunity to go anywhere. There are no locations within, a reasonable distance rather. And so, I mean, for many of our listeners and supporters who obviously empathize with that, I want to highlight that and maybe just share those feelings with everyone else. I mean, imagine being legitimately ill or suffering from some serious injury, and the idea of going to your nearest hospital is 200 or 300 miles with no trains or even in some cases cabs to get you there in a reasonable distance. And I think that that's a really powerful reason why many of us should absolutely be part of this blessed project. I've also just got word that some of our locals have been following us in the Gambia in South Africa. So let me be the first to give you my salam as well. But Fazl Saab, tell us a little bit about maybe what's happening on the local side of things, because you've been to Cote d'Ivoire a couple of times yourself, is that right?
Yeah, and actually, when we were first putting the hospital together, even a couple of our board members of our local team in Cote d'Ivoire shared stories where the care that they expected for their wives hadn't been optimal, even in Abidjan. And it's been a long journey. There was Dr. Nizamuddin Budun, who sadly passed away. He was serving for decades in Cote d'Ivoire from Mauritius. And then the local team, originally the chairman was Diamande Valle, his vice president was Fafana Mamadou. When we were watching the audience there, it was great to see Yaya Ouattara, our chairman. It was great to see Dr. Ahmed Koulibaly, but also Mamadi Silla, who's our general secretary. But there are many others who've played a role, like Konef Seni, Amadou Bapina. And I think for them, it's going to be a labor of the last 15 years. I can imagine their feelings when they see the hospital going live and knowing the type of experiences that their loved ones have gone through. Now, hopefully, inshallah, we can offer much better care to people, even without the means to go to this kind of hospital.
Yeah, and that's really significant because, I honestly can't think of a better objective than this. I mean, this is such a blessed initiative. I mean, people go and build sheds in their back gardens and they think to themselves once it's all up, oh, this is so great, only to put tools and rubbish inside. People build homes in their home countries and they feel really excited having gone through a year or 2 or 3 when it's finally completed. And in some cases, it just turns out to be a summer home or something that you'll rent out for profit. I mean, I would really like our listeners to really think about the impact that this project that has gone over the last 10 years, over 10 years, that has been in the making for the last decade or so, and think about the impact that it has not only on the geographical location, but on the people who go there. I'm talking the children who go there with injuries, the parents who go there, the grandparents, the siblings, people who go there and sit in the waiting room, knowing that they're getting quality service. I mean, this is what we're asking you to donate towards. This is what we're asking you to support. And if you think about the joy that a shed in your back garden, or maybe a vacation home, or maybe even your primary residence, all the memories that are generated in such a place, imagine the countless people who will be supported in a hospital, people who are going through discomfort, even as extreme as misery. This is where your dollars are going to. This is where your pounds are going to. This is where your rupees are going to. This is where all of your blessed efforts are going. So I would really like to thank everybody who has supported us thus far, but we really need your help. I think we're in the last stages. And I mean, tell me a little bit about what's happening now on the ground. Like where are people's support going as far as you know?
So we're now at the final stage where we're bringing the last remaining equipment into the hospital. We are starting to do the recruitment. So we're hoping to, inshallah, be live in September. And so it takes a while to recruit the staff, train them, get them familiar with the processes of the new hospital, get them familiar with the equipment, and not just the processes in the hospital. There will be some things where we can only go so far in treating the patient, and we need to have referral pathways to surrounding hospitals like Trishville. And so that takes time to bed in. And so we urgently need support from our donors now to operationalize the hospital. We've gone a long, long way. You'll see in a few minutes. Hopefully they'll be ready to show us around any second now. But it's the operationalizing that we need the help with. And funny enough, you mentioned about people like Yankuba in Gambia and the team there, and Tawfiq and the team in South Africa who are watching us. We're doing the same there. I was in South Africa and Eswatini 2 weeks ago, and we're starting to provide access to care for people in the townships, the most deprived areas like Khayelitsha and Soweto. How can they get access to eye care and other healthcare? So the same process, same journey we're seeing in other countries. I think they're ready for us in Ivory Coast now.
8, 7, 6, 5, 4, 3, 2.
I am outside the hospital now, the Masroor Healthcare Clinic, and I'm with Majid Khan Saib, who is the CEO of Humanity First Healthcare International, as Humanity First Healthcare USA. Majid Saib, how did this start? Where are we right now? Tell us a little bit about the history.
So it's, as you know, before in the pre-med, Shabir Bhatti Saab mentioned that it was by Ahmadiyya Muslim Association UK, but it was then handed over to Humanity First. We laid the foundation stone of this facility on 21st of November 2021. It is
right after COVID, yeah.
Right after COVID, but during COVID, we have been coming very regularly.
Wow.
So you can see, if you could see, they're located on the main highway.
Okay.
This highway goes to 4 in West Liberia and Guinea, and to the north, 2 landlocked countries, which is Burkina Faso and Mali. Why this is important? Because this is going to be, in future, a strategic location to serve all those countries which do not have these facilities.
So in some ways, a hub and spoke model where there'll be clinics in those countries.
Exactly.
And if there are hyper acute needs, they can come here.
Absolutely.
And the freeway connects these countries in hours.
Yes.
That is an incredible, alhamdulillah, that's an incredible location. So in 2021, you started the construction. We're almost complete, but there's a real hospital here. It's not an idea anymore. What is around us? I mean, this is one entrance, and then there's a second entrance. How does that work?
So if you can see the building, we are standing in front of the main reception. And then on the left, on your left, you can see the emergency entrance. In the emergency and the main entrance is always separate, because of so many reasons. So that is how it looks as of now. And let me now take you inside.
Before we go inside, I'm just trying to understand in hospitals, and this is because you worked on Humanity First Hospital in Guatemala as well. You recognize the need that the emergency room entrance is separate from the regular hospital, and that's
right.
the little things that matter.
Right. So as you walk up to the reception, you will understand that we have tried to capture the concept of hospital. It is not, it is hospital.
What does that mean?
It means that you combine hospitality with the hospital.
That's incredible. That's service with a smile.
Exactly. So as you enter, it does not look like a typical reception.
So we're here, and so what is the hospitality piece of this?
So hospital piece means that it has to be something which welcomes you.
Mm-hmm. Mm-hmm.
When you enter a typical hospital, you
the patient is already stressed out.
Right.
You want the patient to relax, and you want the patient to feel less stressed.
Right.
So that is where the hospital concept comes.
So I walk in, I'm stressed. If I'm here, I have a need
Yes.
that you're going to fulfill. I see a great
Exactly,
entrance.
exactly.
I see natural
High
light,
ceilings.
high
Yes,
ceilings,
exactly.
natural lights.
And the
seating.
greens.
And green.
Yes.
Okay.
Green
and
is
this
very,
is an
very
area.
important.
Yeah.
Yes, yes.
Yeah. And then you have all these rooms. I'm glad you have a toilet. And what is a consultation?
So there are 8 consultation rooms. The concept is a little different from USA. We don't have exam
Should we
rooms as
enter one?
such. Yeah, we can of course enter one. So it's a typical exam room.
Mm-hmm.
And remember, this furniture, there's one element is how you control cost in a project like this. If you the cost of this table is $38, you're not going to believe me.
I will not.
Yes. So that is how.
And I don't.
So that is how you control the cost.
So help me understand. There's a lot of donors who are looking to invest in a project like this. First is it real? Now we're standing inside the hospital. Second is, will my money be used wisely? If you actually bought that table right there for $38,
yes,
that's pretty incredible.
Yes, and that is why I mentioned it. The donor needs to feel comfortable that whatever donation he has done has been used wisely. And I will just also mention,
yes, post infirmary.
Yes.
This is the nursing station
This
here.
is the nursing station. As I mentioned, we have 8 clinics.
What is triage?
Triage is where you bring the patients in, and before it goes to the donor, there are some vital signs, etc. is done here. And if the nurse feels that patient needs to go to another person, not the one he or she wants to see, then it is advised.
Would there be a doctor like Dr. Fahim Ahmed here or Dr. Ahmed here?
No, this is usually done by a registered nurse.
Okay, okay, that's helpful.
Yes, yes.
And Munam Saab, this isn't pretty. As I come inside, I see the reception, and the reception in Guatemala was beautiful as well. It's your second child. Do you love him the same?
Exactly. No, I think this is beautiful. Obviously, the concepts are the same here.
Yeah.
So one point about Majid Saab, the amount of effort and journey that he went to China hundreds of times, I think, is just as amazing that what he's been able to do from the cost perspective and the beautification of this, making like a true hospitality place, comfort and everything else.
That's amazing. So now where are we?
We are now in the dental clinic, and something I would like to mention. There's a dentist from Belgium. He walked into UK Jalsa last year and he said, he's a dentist. He said, what do you need for Masroor Center for Health?
Let's have someone sit inside here.
And I said, can you give us a dental unit? So he said, yes.
Really?
It is his money. And of course, we were able to get a much better deal because this we got directly from China, eliminating the middleman.
That's amazing. Dr. Fahim Ahmed, I know you're not a dentist, but I know at 2:30 is the best time to go to a dentist. And so equipment, when I have a toothache, I can't pay attention anywhere. MashaAllah, we've got, Majid Saab got donations. What happens in this room?
So this is the place where the dentist pretty much can do that is a general dentist will do. They can do tooth extractions, fillings, cleanings, and crown placements. So the machine is equipped to take care of that, and we'll have an X-ray machine here soon. So all of general dentistry and some advanced dentistry and part of oral surgery that does not require general anesthesia can be done in this room.
And this in terms of dentistry, how critical is it relative to other pieces of medical practice?
So it's crucial. So the mouth cleanliness and the care is crucial to our heart, to our GI health, so if you don't have good oral hygiene, bad teeth, it affects your overall health for sure. Yeah.
Thank you for
demoing all the great equipment here as well. As we walk out, Majid Khan Sahib, we have Dr. Ahmed, local doctor we'll talk to in a few minutes.
Yes.
But Majid Sahib, so this is just one wing. As we walked in from the reception, we saw this side, and now we are walking to the other side and understanding.
Right. So we will go back to the main reception, and I'll take you to our pharmacy. And from there, the first segment we will close, and then we will meet.
So now we're back in the lobby. Again, natural light, lots of great greenery to calm people's nerves. This is good medical practice for the doctors.
There is one thing very important is that as we work on a model which is made around helping people, so we have a social service department here as well. Unless you want to help,
so that's mental health as well as physical.
Absolutely.
That's amazing.
So this is the social service person determines whether you need, what kind of help you need financially.
I see.
So,
I see. I see. So because it's a sliding scale in terms of cost.
Yes.
Okay.
Absolutely.
And now we're entering the pharmacy.
The pharmacy.
And everything is written in French and another language called English, I hear.
So yes, this is, of course, we are ready, but we are not ready. Because we have the infrastructure in place, and we are not ready because we don't have the details as yet. We have to set up the pharmacy, we have to get the stocks. So this is where the call for donation comes in.
So help me understand, this is a hospital that is being built through the generosity of donors from around the world who may never get to physically use this hospital. And as a result, providing a hospital of this stature provides a hub and spoke model for 4 countries, not just this one, and we're strategically located on the main thoroughfare that connects countries. So if someone has heartache or something in another country, they can go to a clinic of Humanity First or Ahmadiyya Muslim community and be transferred here. Right now, it was told that some go all the way to Rabwa. What are the financial needs? While the $38 desk is great, there's some other equipment that costs a little more?
Yes, of course. There is, we still need, at this moment, we are still short of about $500,000 to open, and that is, I should tell the viewers that the expected opening or inauguration date, as advised by Hazur, would be in the second week of September 2026.
That's not very far away, and you need a lot of dollars.
That's not very far, and that's what. And remember, as you mentioned, donations. This hospital came into being with the help of donors from Canada, from UK, and international.
There are wonderful donors there. Dr. Fahim, this hospital, we're going to go to some donor stories in the UK next, but from your perspective as a medical professional who's worked in multiple countries, is this a good place for folks to invest their hard-earned dollars to make a difference in the world?
Absolutely. Having been to Tahir Heart and the Nasser Hospital, I would say that this is the same caliber and has the potential to give both those hospitals run for their money. I think the design and the architecture and the thought that they've been given to how the patients go through their journey in this hospital pretty unique. So we've learned from those experiences, and Majid Khan has hand in all 3 hospitals that I mentioned. I think he's using those experiences here, and he made even a better product.
And if I can add a comment to it also, when Nasser Hospital was completed, the amount of money that he spent and what he put in
Nasser Hospital is in
Guatemala. And easily, I think when we asked the government that what would, in your mind, this will cost, it was double the price that it would have cost them to build and the quality that he brought in. So a lot of hard work went in. So from dollars perspective, every dollar is being stretched to maximum through his hard work. And I think quality is supreme. I think this is another notch up, from the last one too. This is,
So as we transition back to the studio in the UK with Fazal and Hamza, I'd like to share it from the person who is the CEO of the hospital, Majid Khan Sahib, who's operationally managing this. Every penny, pound matters. We are doing the best hospital in the world, and you heard from a medical professional that they're doing great work to make sure it's one of the best hospitals, and not only by US standards or UK standards, but standards. And you heard the Humanity First chairman as well, that your investment will matter and will make a tremendous impact, not only in one country, but actually 4 to 5 countries total. With that, we'll send it back over to the UK, to Hamza Ilyas Sahib and Fazal Ahmed Sahib.
This is the exciting bit.
It's coming to life.
Yeah, you can really see it. And the two things that came to my mind was these sayings. One was for the people, by the people. I mean, you really see it, take shape. And for all of you who are out there who have supported this project, who's contributed toward this project, I mean, this is really so heartwarming. For the people, by the people.
I think we've already had some donations coming in, haven't we?
So far, we've got 15,000 has come in. I mean, this is what we want. And the other saying that came to my mind was, not one of you, this is one of the more beautiful hadith or sayings of the Holy Prophet Muhammad, peace and blessings of God be upon him. And he says that not one of you is a believer until he likes for his brother what he likes for himself. And I mean, you think about all of those people that are going to be benefiting from this just beautiful, beautiful initiative. I mean, this is one of the few times in life where you say, I'm absolutely happy to contribute to the construction of such a beautiful building that hopefully, God willing, I will never have to visit. Right? So
but if you did, it would be good though.
But if you did, it would be a beautiful, beautiful experience, as we've seen from these pictures. All right, so 15,000 so far, ladies and gentlemen. And I mean, what I really want to hear from you at this stage, Fazal, is talk me through some of these opportunities that people have to contribute. Maybe walk me a little bit through the sponsor projects. I mean, what are people looking at?
So first of all, where we're at now, you can see the hospital is largely there. We're now in the process of recruiting the team, and it's going to take 3 or 4 months to bed that team in and then open the doors to the general public. Salaries there are a lot less than, say, in Europe or North America. So nurses, salaries are maybe $2,000, $3,000, $4,000, $5,000 a year. So every dollar, every pound is going to contribute and make a big, big difference. You can see the quality of facilities will attract and retain high quality staff.
The Masroor Center for Healthcare, the flagship project by the Humanity First International,
is now need additional funds coming in. We need right now, because of the where we are in the process, every dollar is going to make a difference. If people can give more, we have a donor wall, and if people commit to $1,000, they can put the name of themselves or a loved one onto our donor wall. There are still sponsorships. So they showed the dental unit. This was Dr. Musa, who's a dentist from Belgium. Hopefully we'll be speaking to him later. He is committed to that unit, and he's going to be visiting and improving the standards of dental care and training the local clinicians. So there are other opportunities like that. Well, there are still units that if people wanted to donate, but for the average donor, please don't think that you need to be giving a huge amount. If you can only afford £2, £5, £10, it's all going to help us get to September.
Absolutely.
But we need those funds today. We need them urgently.
And I think the real stress here is that, I mean, you're thinking about this project and this project now, I mean, the deadline is fast approaching. We're headed toward the opening September this year, people, right? So you've seen all of this progress that was made so far in these videos. I mean, I really enjoyed even seeing the plants in the waiting room.
That's actually critical. We learned from Guatemala, and even before that, that having lots of natural light, having greenery, having wide corridors accelerates wellness and gets people out of the hospital quicker. And it's something that we're still learning in the NHS. So we're about to see other parts of, I think they're going to move into the emergency wing of the hospital, I hope. You're going to see other parts of the hospital. You'll see that as a continuous design feature. Natural light, greenery, wide corridors, beautiful environment.
And the other thing that I was reminded of, I mean, one of my childhood doctors, and this is amazing that I can remember this, is being there in the waiting room. This was the one doctor's office that I can recall going throughout my entire life where I actually enjoyed being there. And the two things she had, and I was a child at the time, were toys, right? Very attractive. But I remember it was always very green.
Yeah.
Lots of real plants, not the icky plastic plants. I mean, lots of real plants. And when I think about the Guatemala hospital, I mean, every time they showed the footage of the Guatemala hospital, this is what you often see, what you've just mentioned. Lots of natural lighting, lots of plants, very green. It's very calming. And I was listening to our team there in Cote d'Ivoire talking about, how much it contributes towards the wellness. People coming in there, many of them are in a state of discomfort. They're in a state of panic. I mean, walking into an area like this is super, super helpful. But ultimately, it all is just all represents some of the benefits on the periphery.
And where the hospital is a very green area. So as they said, it's on the northwest outskirts of Abidjan. It's next to the highway that goes to Yamoussoukro, Bouaké, all the way up to Korogo. That whole area, as soon as you leave the city, is very, very green, very lush. And so the type of greenery that we're putting around the hospital and the landscaping reflects the natural greenery of that region. So we do a lot of work in the villages there. We do water installations. We're assisting with farming projects. We're in 3 weeks' time we'll be doing Qurbani, and people are making their final donations for sacrifice as well. But that is nature of that part of the world. It's very, very green. It's very lush.
Well, tell us a little bit about how people can donate. I mean, like right now we've got folks in the USA, we've got Canada, we've got it happening in Germany, of course, here in the UK. How can people contribute to this?
So they can either contribute through their local branch, or if they're from anywhere in the world, they can go to our website, www.humanityfirst.org. They'll see the campaign there for the hospital, and they can donate. If they want to donate more, they can do. If they wish to donate in the name of a loved one, once you enter your details, it allows you to say, I want to do this in the name of a loved one. So I think we're now ready to go back to Yopougon and have a look at other parts of the hospital.
4, 3, 2, 1.
Welcome back, and you just heard a great conversation on the importance of giving to this hospital, and we are now in the lobby, in the reception area of the emergency room or the ER room, and back with Majid Khan Saib and others, Dr. Ahmed, as well as Munam Saib and Amir Saib, Cote d'Ivoire as well. Majid Saib, tell me about the reception as we go to the ER.
Yeah, so as earlier I mentioned that the ER waiting area is always separate and the entrance is separate because you don't want to have any issues bringing the patients.
Yes.
And the staff can be really quick. This waiting area is a little bigger than what we actually need, and we have of course a triage station.
Okay.
This is going to be used for all those waiting for their for the surgeries, which is just next door.
Okay. Before we go there, we're going to go to the actual emergency room, and we're here with Dr. Fahim Ahmed, who is the medical director of this facility, as well as Guatemala. Dr. Fahim, this seems like a sizable room here.
Yes, very well thought out layout because as Majid Saab said, emergency care, the diagnosis really matters and every second matters, especially when you have really sick patients. So this space was designed to have resuscitative equipment. The nursing station is right in front, the doctor is right across the hallway. And as the patients come in, they will be evaluated here and very quickly it will be decided what level these patients need. So the emergency room, when the general care is done on the other side of the hospital can be very busy or very slow. And we expect this place to be busy because we're right on a highway. You can expect patients that are critically sick. So I really like the way this place is designed.
There's quite a few beds. There's about 5 beds. Is that an average emergency?
So you can never predict an emergency room. I think this is a good size right now, but obviously bigger disaster that happens, then you have to arrange patients on the beds. But I think for the size of this hospital, this is appropriate at this moment. We'll see how it goes.
Yeah, great. And so as we leave the emergency room, Majid Saab, I appreciate the care that was given to every step of this journey and this location. Tell me about the corridor. Tell me where are we going?
Yes, so we are going to the operating rooms, patient, but the corridors are very important. They're called the arteries and veins because they support a 24/7 facility. The life of hospital depends on corridors, and if you see, you must have seen in USA many hospitals, their corridors are filled up with operating stretchers and everything because the wider because you need extra space. And as I was mentioning, 5 beds may not be enough, so you may have to treat some of them in the corridor.
So this is an operating room as well.
I mean, in an emergency, we have dealt with more than 13 to 15 emergencies in other hospitals. We had 2-bed emergency to go through the.
Dr. Ahmed, where's the nearest hospital right now to here? Where would individuals go?
Where is the nearest hospital? French.
Is there another hospital here?
Yes.
Okay, but it's far.
No. He doesn't understand.
Yeah, it's okay.
Yeah.
Non, il y a un hôpital universitaire à 4 km d'ici, mais ils sont en réfection. Donc l'hôpital, actuellement tout est fermé, les urgences aussi sont fermées. Il semble qu'ils ont ouvert récemment, mais c'est pas encore fonctionnel tous les services. Donc ici, effectivement, on est bien à cause de l'autoroute qui est là. Et tous les accidentés qui arrivent pourront venir directement ici pour se faire soigner. Voilà l'importance de cet hôpital-là, effectivement. Donc, je sais pas si
4 किलोमीटर फासले पर एक अस्पताल है लेकिन वो सही तरह काम नहीं कर रहा है तो इस एरिया में यही एक बड़ा अस्पताल है जो हमारे वहाँ.
So it's pretty far. Now we enter corridors as well.
Yes.
That's a great distinction.
So,
now what do we enter?
We are enter the operating room area. We have a pre-op here, a doctor's lounge for the first, and then a pre-op. And
what is pre-op?
Pre-op is where you prepare the patient for surgery.
Okay.
And then here is a typical. We have 2 of these, 2 operating rooms. But
we won't have anyone get in.
But, because but there is something for the views to know that this is not a very typical flooring. It has a copper lining underneath. It is called conductive, non-static. So the current doesn't shock the equipment and both for the surgeon. So this is specifically, and you can earth the copper going and earth those cables. So this was again brought from China. It was a
that's you learned that through experience, I take it.
Yeah, obviously, if you avoid the middleman and if you have the local facility to do it well, then you are a winner.
That's great.
Otherwise, you can have and this of course have.
What is up here, or maybe
there is just about a word about the economy. There is a certain percentage of air which needs to change and create a positive pressure the OR, otherwise you have problems.
Okay.
So, and then of course you want to, Dr. Fahim would like to.
So as Majid Khan Sahab mentioned, so that's the anesthesia machine. You have the resuscitative machine. Then you have lighting for the OR. And
This is all just lighting.
yes.
No, that's
Those
lighting.
two are lighting.
Yes.
And then you have a buoy there where you can have, like you mentioned, cautery and other equipment. These strips are for orthopedic surgeries. They will have to position patients in different ways. Obviously, gynecological surgeries can be done here or in the delivery room. So, and then I think the flooring, as you mentioned, is as you use the electrical equipment for the shock and stuff. So
this is of the world-class standards.
yes, 100%.
You both agree. The doctors agree, and the operations have nailed it.
He just called me a doctor.
Yes, which, that honorary degree, I would take it. Okay, where are we headed next?
So we will not go to the other operating room.
Oh, of course, it's similar.
There's a sterilization room.
Yeah,
There's a post-op. Then we are now going to where me and you were born.
Yes. Oh, perfect. Yeah, this is not Rubwell, but it's pretty close.
Yeah, of course. So we have this. This is the maternity wing.
Yeah.
We have a little waiting area for fathers.
Fathers, okay.
Put them in place.
Make them work. Okay.
And then we have three maternity suites. 1, 2, and 3. Let's go in
one. We'll go in one.
Yeah, just one. So this is basically designed on the concept LDR, which is labor, delivery, and recovery. So you admit the patient in here, and the patient goes out from here. You don't have to
Okay, you take the bed with them.
Yes.
Okay.
No, I mean the patient out from here.
Oh, I see. They stay in one place.
Yes,
okay.
They stay in one place, and this is Ivory Coast is a very demographically, they are very quick on babies, etc. So we have
great.
over of 2 beds.
That's great.
So
that's great. So this is the maternity,
yes.
And when there is a challenge in the maternity ward, then you have an ICU, a NICU as well.
Right. We have something. We have a unit. Yes. This, but again, we don't have the equipment. And
but inshallah, with donors today, we will.
You see, the place is there.
Yeah.
There's a little window for the parents to see the babies and feel good. But we need equipment for this place, incubators and warmers, etc.
What does that equipment look like? I mean, there's incubators, there's warmers.
Basically, incubators, warmers, and refrigeration for milk.
And those aren't $38, I take it.
No, those incubators are very specialized. Absolutely, yes.
And then with our donors today, this rooms will be filled.
Exactly. That's what we're hoping for the day. We will have enough to go on, because unless we have now, the inauguration cannot be in September.
Yes.
You need to order. They have to deliver, you have to train, you have to get the staff on. So this is this is critical.
Madam Saab, this is your second child is being born out of this NICU.
Right. No, I think he's absolutely right. And I think there is one that you need funds now to get it finished, then to operate it. I think that is needed. And we have been through that experience in Guatemala. So I think even I will talk about it, that even from USA, we will contribute to this program.
That's great, and so this is great, and as we come out, and I know we're short on time. Where are we headed next?
We are going to the intensive care unit.
Okay.
In a smaller hospital, CCU and ICU are usually combined.
Okay. What is CCU?
Cardiac care unit.
Okay.
Or coronary care unit.
Okay.
And intensive care unit. ICU. So what happens is that the care standards differ, and you can do it with the specialized staff.
Okay.
So you train differently for the coronary care patient and for the other ICU.
I see. So where are we entering the ICU? Not the NICU, but now this is the ICU.
Yes, this is ICU.
Intensive care unit.
Yes, we have some of the stuff. Of course, we need ventilator. Without that, it is not going to work.
Mm-hmm.
So
tell us about the ICU and what you need here.
So again, I think the location is very important. This intensive unit is very close to the OB-GYN floor, very close to the OR. So that's strategically being done. And the equipment we need is ventilators. We definitely, no ICU is complete without ventilators. And then you will need IVs that can measure the drugs. And we need those IV poles that when we get these critical care medications, and this does make a difference between life and death of a patient. Somebody comes in with respiratory failure, they can walk out of here if they have a ventilator and the right critical care.
And how long are people usually in an ICU? God forbid any of us need to be in one. How does that work?
We would like to make it a quick, this is not a destination place for anybody. We would like to make the stay as short as we can, but certain surgeries and certain diseases have longer recovery, and we would like to give that chance to that patient. So if it is me and my doctor, it has to be a doctor, my doctor says if we keep him on a ventilator, he can live after, but it will take about 2 weeks. I want that chance. But if my doctor says it is futile, then it's different. So I think we leave it to the medical team. Yes. The medical team says they can turn around very quickly, they get out quickly. The medical team says give them time, we'll give them time.
That's great. With that, before we go back to the studio, we saw the ER, we saw the ER reception, we saw the ER, we saw the labor and delivery and recovery, we saw the NICU, the ICU, and we are here. This is the heart of the hospital, and we saw how every corridor is designed to scale as well. How can people help?
Well, as Dr. Fahim said, and as Monem Saab was saying, I have this mic. So okay. So what I feel is that they can really help in stepping up with all the donations. We have many rooms which we can dedicate to the families. They can have their names outside. We have half of the hospital already, people have donated for that. But we still have so many clinics and rooms which we can dedicate to the family or the person or in honor of the families. So maybe that is something.
That's incredible. Many of us have been to a hospital at least once in the services we've received. Now you can make those same services available for 1,000 people in a part of the world you may never visit. We're going to go back to the studio in London and have them take over from here. Hamza Saib and Fazal Saib, over to you.
Wow. I was just so moved seeing that footage of the hospital. One of the things that really stuck out to me is, you often think of these buildings, these facilities as something that just sort of exists on its own, don't you? Mm. Right? You don't actually think about what the meticulous planning that goes into each and every room, down to the sizes of the corridors, what each of the corridors should be linked to. I mean, there's so much thought and strategy that goes into the design of a hospital. And that's really what stuck out to me, in addition to how beautiful it is. But the other thing that I was really moved by, we've heard so much in this world about hospitals being destroyed. And it's really heartbreaking for many of us. And it dawned on me whilst I was looking at this footage that, wow, not only is there a group of people out there building a hospital for people in need, but this is such a blessed opportunity for us to even be a part of that. I mean, it's one thing to look at social media or any kind of media and say, oh, this is really awful. There's so many hospitals going into ruin or underfunded or are being outright destroyed. And yet, here's a group of people, and it's happening at the grassroots level. Here are a group of people who are building hospitals for people who need it. And I think that that's extraordinary. And in fact, I'm going to lean into that thought because it looks like we're up to $25,000, I think it is, right? Not pounds. We're up to $25,000 in donations. I mean, this is the time to, if you're not already supporting this beautiful, beautiful project, this is the time to absolutely be a part of this project, whether it's little or much, right? So if we're talking smaller amounts, 10, 25, or even 1,000 or more. Give what you can, be part of such a beautiful initiative. And I think we're on again. What do we have so far?
I mean, even from what you saw.
6 minutes, 6 minutes का? नहीं 6-7 minutes. That's it.
So that neonatal intensive care, a lot of work's gone into the medical gas and other infrastructure. Now, $500, $1,000 will get those incubators that are going to save those babies' lives. Remember we said the 3% of 5,000.
Show the toilet a little bit.
Babies won't make it to their first month anniversary. And it's a simple incubator with a phototherapy unit installed that helps save their lives when they have jaundice and other conditions. Those are the small bits of equipment we now need to operationalize the neonatal intensive care unit. Similarly, for the ICU, we need infusion pumps, we need ventilators. It's the relatively smaller equipment. So now we're going to have a look at some other parts of the hospital.
Welcome back to the Masroor Healthcare Center, and we are here in Cote d'Ivoire. We're with Majid Khan Saib, who is the CEO of Humanity First Healthcare International and Humanity Healthcare USA. We just saw all the services from ER to NICU to ICU. I learned a lot of words so far. And after those services have been received, where do patients go next?
So, from ICU or from any other, from ER, they are transferred here, like for a step down, from ICU to the inpatient room. We have designed it in a way that at least 2 patients, there's no general ward. So we have designed it that it's sort of a based on semi-private. So if somebody needs privacy, they can have the full room to themselves. But typically, focus on a semi-private.
Yeah. Yes. And you've got a TV and you have a...
Yes, we have a TV. It is air conditioned. We also have a sofa, sort of a chair for the attendants as well.
This is really important. So this is incredible.
Exactly.
And as people come with their spouse or their parent to take care of them. And my God, this bathroom is pretty incredible.
Yes. I mean, we have tried to give them whatever they would expect, from a high-class facility. So
hospitality matters.
Yes, hospital. And there's, again, something I want you to see.
Well, what is this? This is beautiful.
Yes, this is one of our gardens, inside gardens. You can see the wire gauze, the wire mesh on the side, so the insects cannot come in.
Now, this bamboo must be very expensive.
No, the bamboo is expensive, but we got it for the roof formwork or the shuttering. And of course, instead of throwing them away, we wanted to use them.
Help me understand this. So you used it with construction process,
yes.
And instead of tossing it, you reused it?
Exactly.
Wow.
So that gives a more natural feel. If we just had, plain walls, it would not give this look. So the bamboo and the greens, and of course, the greens, the greens is so much important for the recovery of the patient.
There's research behind
this. Yeah, of course, there's research behind it. So now we are entering the support area.
Okay.
This is what supports the whole hospital. We have the food.
The real heroes.
This is the dining for the staff.
The healthers.
Yes.
Okay.
The heroes. And we have a small kitchen capable of not only providing food for the patients, and we have a cold storage at the backside.
Okay.
And this is, of course, meant not only for the patients, but for the cafe.
I see. And dining for other individuals. Of course, yes.
Because it will not become to give more.
Okay. Yes. Before we go forward, so now we'll have staff that will be cooking.
Yes.
Okay. Now, what is this dry storage?
Yeah, this is the dry storage for the kitchen. But here it is something which, again, the viewers would be interested. This is a laundry. So
you need this.
Yeah, you need this. You can't function without it. So it is received, it is washed, dried, ironed, and then taken to the store, and from there it goes back to
That's
the
amazing.
wards.
And we don't recognize the little things like the copper and this. It's underappreciated, but it's critical.
Of course. These are they say that designing a hospital is only the second most complicated thing after nuclear plants.
Really?
Yes.
Wow.
Yes.
Wow.
We are now going out, and I just want to show you something. You see this structure in front?
Yes.
This structure, it used to be a office. This container used to be a site office for 4 years.
Okay, before construction. Okay.
Yes, before. No,
Yeah.
while
during construction.
So we turned it into a cafe.
Okay, and you use bamboo. Looks great.
Bamboo, and so this is now a cafe for the patients, the attendants, and for patients as well.
Families as well.
Families as well.
Okay.
And we will have a live screen showing their positioning in the outpatient.
Oh wow!
So if they can, if
technology at play.
Exactly. So
this is it's working.
Exactly. I think it's absolutely working. One point I will make though is, Majid Sahab spent 4 years working out of that container.
Wow.
I mean, it's amazing what he's been able to.
That's amazing.
So
how do you support the electricity? We're in the developing world. The electricity, there's a lot of electricity and water needs and other needs for a hospital. How do you support all those things?
So we dug our own well, of course.
Okay.
And then for power, something I would like to mention. Our support for this hospital. The first one would be the green energy, the solar panels, and you can see in front.
Incredible.
Yes, and remember, this is going to produce 150 kVA, enough for the whole hospital.
150 kVA is enough for the whole hospital. Okay. But what happens at night?
We have lithium batteries, which can store the energy, and if it is again for 150 kVA, and then if you are able to use 10 every hour, it can go on hours. So and by the time the sun comes out the next day, the sun is ready to recharge the batteries.
To support.
So this will also be the first green energy hospital in the country.
That is incredible.
The first.
The very first, and probably the area.
They use solar, but it is not fully covered. The hospital it depends on other, of course. And then as you can see, if you can see from here, and he's probably
so there's some other facilities here too.
Yes, a power backup generator.
That's great.
We have a morgue, hopefully.
So morgue, every hospital needs a morgue.
And then further up, you have a medical guest. This room, what the lithium battery storage is.
Wow.
So this is where we are. Because the high energy costs, so we will harness the natural energy to use it, and thus, of course, reduce the operating costs.
I mean, that's incredible for donors and investors who are thinking about this.
Yes.
If you invested in this, with ongoing costs will be much lower than anywhere else.
Absolutely. That was the main focus. And of course, again, like a responsible organization, we would be focused on green energy for the future.
So just roughly cost-wise, the solar system.
The solar system cost here is about $135,000.
And it can sustain the load for the whole hospital.
For the whole hospital. Actually, the cost can be in 1.5 years if you fully utilize it.
The payback is little to over a year and a half. That's amazing.
And not only that, the fact is that the energy here is not stable. So even if the energy, we got to have something which is stable.
That's incredible.
It's a green project,
Yes,
right? I
yes.
mean, you're not adding any pollution from those generators
Yes.
also.
This is, I mean, as we look around, and we happen to be here, as we look around, this is just an incredible hilly area. Now, John, I've heard is like the Manhattan, Africa. We're a little bit half hours away from it. We have beautiful views. We're going very renewable energy from the bamboo being reused to the electricity, to the water, to backup storage. This is a world-class facility.
Yes. Probably from here, this probably ends our segment here. And are we ready to?
Yeah, so we're gonna go back to the studio, but before we go, I just want to share that if you have not seen some part, we welcome everyone to come visit. But I've seen from the roof to the entry point and everything in between, and there's much more that we have to leave out due to time. But this is the most incredible facility that you would be proud to invest in for generations. Thank you, and we'll be going back to the UK studios with Fazal Ahmed Saib and Hamza Ali Hassan.
So we've been seeing the developments at the hospital, and it's really, I remember when it was just a blank field, and it's really amazing to see how much development there has been. Now, what you saw with the solar and with the other setup is we're trying to make the hospital as sustainable as possible, and as they were explaining, the power is variable there. You can't guarantee, especially in high acuity area like intensive care, operating theatre, you cannot afford to have power going out. And so we have backup generators and we have solar power, which is going to make all the difference to the hospital. I think on the right hand side, you're seeing, is the drone footage starting? So you're going to start seeing the lie of the land of the hospital. And in fact, when we first started looking at locations, as I mentioned, the poorest patients that we needed to support were in Abobo, but that's in a part of town that private patients wouldn't have gone to. So this is a piece of land on a hill overlooking Abidjan and Yamoussoukro and Yopougon, and it's the main highway. So patients coming out of the main city, Abidjan, can access this site. Patients coming the other way from Yamoussoukro and Bouaké can also access the site. When we first visited this plot in 2013, it was fairly sparse, but now a lot of the surrounding areas have built up, and so there's a bigger population that we're serving. You can see on the roof the solar panels that we've installed that Captain Margie was talking about. You can see the air handling units that are going to be used to maintain the environment of the hospital. And in fact, a lot of work has gone in over the last 2 years on the medical gas infrastructure and the HVAC, as they call it, so the cooling and so on. In an operating theatre, it's not just about keeping the operating theatre cool, you also need to keep it sterile. And so at the top of the roof, you have a HEPA filter, and the air that's coming in is replenished frequently to keep it clean, so that you don't have germs circulating in an operating environment that could affect the patient. And you can see around the hospital, we have land for car parking, for greenery. The blocks at the back are for support services like medical gas, the mortuary facility, the water facility. For sterilization of surgical instruments, we're going to have a reverse osmosis water plant. You can see the two entrances. The one nearest us is the emergency entrance and for maternity and the operating theatres. The further one is for outpatient clinics, for things like dental and eye clinics and other specialisms that we're gradually going to invest in over time. We're also going to be working on the landscaping of the hospital. Here you can see the main highway, and actually we now have a route up to the hospital from the main highway. This was a concern 10, 15 years ago because it was a rickety, steep road heading up from the road up to the hospital. But now we have a decent road. And this area is we're going to keep investing in the landscaping, not just to make it look nice, but as patients are recovering, they'll be able to go into some of our covered garden areas, and that again will accelerate their recovery and get them out of hospital. We know even here in the UK that the longer you spend in a hospital, there's a chance that you acquire infection. So as we've learned from Guatemala, we're building a landscape and environment to get patients out of the hospital as quickly as possible. And I think soon we're about to go back to the hospital. The more people see, hopefully they will get more excited to donate. But every dollar, every $100, every $1,000 is making a huge difference.
What I found amazing was that container. So the container that they were living in during the early construction, they've now made it into, what is it, an outpatient and guest cafe.
It's a cafe. Yeah.
That was just incredible. And the reuse of the bamboo that they had during the construction, I thought
like our background here.
Well, even better than our background. I thought that was amazing. All right, looks like they're ready for us.
So back to Yopougon.
To the Masroor Health Center, as we are here live with Majid Khan Saib, who is the CEO of Humanity First Healthcare International, who has built this hospital, lived here for multiple years, came in and out. Which section are we in now?
So where we are, where all the strings are pulled.
the magic happens.
Yeah, the magic happens. So, to make sure that everything runs smoothly, we have, of course, a small administrative block. If you walk in, there's a small conference room, come training room. Of course, we will be training for the staff and, of course, any conferences, small level meetings. So and we have a whole a director's room and couple of managers' room. So this is where the whole operations is.
Okay, let's move on to see more of the medical facility.
Exactly. So we are now coming back to the diagnostic. This is supposed to be a diagnostic waiting area. So here, let's go there. Now it is converted into a makeshift
studio. And MTA Ghana is doing an incredible job. I'm very impressed with them.
Something. They are doing an incredible job. They have come from Ghana and they have been working day in and day out for 4 days now.
That's amazing.
And yes, and thank you much, Jazakallah, for your hard work.
Bhatti Sahib and many others.
Yes.
Many others.
Yes.
Very grateful for all your hard work.
So we now go to the section of the diagnostic area. This is the lab.
Diagnostic area, which is the lab.
This is the lab.
Blood work, things like that.
Yes, this is one of the areas which we need funds for. Again, you can see we have some of it, but we don't have enough. And this is where the help of donors is needed as of now.
So to help me understand the design of this place and why it seems like there's a little bit more elbow room.
So it serves two purposes, for outpatient lab and inpatient lab. And that's why the space is much bigger than the other hospital we had. So it was thought that we will have one stop, we'll have multiple machines here. And obviously, as you know, diagnosis is crucial. So the patients were admitted 24/7, so their labs will be done here. And then their outpatients will come in here and we'll draw them in. They will wait in the waiting area. They'll come here, we'll draw the labs here, and then
well, for those of us that are novices, what happens it's blood work?
So this lab will start with a lot of blood work. Obviously, that is the key to any medical diagnosis. This is not a radiological suite, but you can have additional things here also, such as time progresses. Sometimes you can have immunological tests and other stuff there. Yeah.
And these machines, now there's a little bit more space for people to work around these machines because it's a larger room.
Yeah, it's important for the technicians to not bump into each other. Other techniques. So I think this place is much more wider and easy to navigate.
That's great. Majid Saab, now we're back we have some great guests watching live
Wonderful.
But I will be back just in a minute. But as we go, we got a couple more things to see.
Yes. So in the same diagnostics, I will just touch upon very brief. This is our ultrasound room in which we have a 4D ultrasound machine, and then of course it is. I mean, we just have the skeleton of the room for now.
Yes.
And so
a 4D ultrasound machine, we already have it.
Yes.
That doesn't cost $38, I assume.
Just about, just about. So this is the main X-ray radiology. As you see, the machines are still being unpacked. And
what is this, though?
This digital X-ray machine. The something about what patients, the viewers will want to know. This is the only room in the whole hospital which has dry walls, and the reason being that we have to have lead sheets in between the wall and
this is proper
radiation out. Same goes for the door, and same goes for the glass.
And sometimes people wonder, well, I could build something for a lot less. In my home, a door only costs X amount.
Exactly.
There's a rhyme and a reason for everything.
Absolutely.
I see.
And the last stop.
Dr. Amit Kulibuli is going to share, who's our local doctor and an incredible doctor in Cote d'Ivoire and in this area, and he's going to share some of what he's doing.
So,
will you be sharing what he?
Yes.
Yeah.
So what is this?
This is endoscope. This is a very high-end endoscope they use for endoscopies to diagnose upper GI disorders, for GI bleeds, for ulcers, and also gastroscopy. And the doctor will speak in French and explain it to us.
Okay, so this happens all around the world, the same system. But what is and how do you use this, and who needs this?
Yes. Translate, Karan.
Yes, we'll have translate. Who needs this, and what is this? What is this for?
Des choses faut expliquer.
Bon, ça c'est un endoscope, c'est un gastroscope. Ça permet de viser tout ce qui est pathologie au niveau de l'estomac, de l'œsophage et du duodénum. Donc on a des malades qui ont des ulcères, hémorragies digestives, qui ont vomi du sang. Donc cet appareil permet de faire le diagnostic de toutes ces maladies-là. On en a deux comme ça. Ça c'est un gastroscope, mais en bas on a un coloscope qui est là, qui est plus long, qui permet de regarder tout le gros intestin et regarder aussi les maladies de l'anus et du rectum. Donc en gros, ça permet aussi de mener des gestes tels que des gestes thérapeutiques, extraction de corps étrangers, enlever des polypes, arrêter des hémorragies. Ça, cet appareil est très très performant et ça permet de faire toutes ces activités-là. Il faut dire que la gastro-entérologie constitue quand même 40% de nos consultations en médecine en Côte d'Ivoire.
So this gastroenterology, would you like to give a quick translation? We'll have him share as well.
ये कह रहे हैं कि इसमें ये जो गैस्ट्रोलॉजी इकोनॉलॉजी भी जो दूसरी है वो दोनों इसमें है और यहाँ पे 40% जो पेशेंट्स हैं वो इसमें जो है आते हैं.
The machine is awesome because this machine has dual purpose. It's for upper and lower endoscopy both.
What is upper and lower endoscopy?
Upper is just looking at the esophagus, the stomach, and to the first part of the duodenum or the small intestine. And the lower, very important to diagnose cancer. So it's looking at the whole large intestine, and we do very rigorous screenings for those. So this is a high-end machine that thanks to our donors we are able to get, and then we have the expertise of Dr. Ahmed Kokakor to use it. And this area will benefit greatly from this.
And then there's a lot of demand, about 40% or so of the locals who need this machine, right?
Yes, and from what my earlier discussion with the doctor was, in this area, the gastrointestinal diseases are very, very, in addition to the infectious disease, but, if you look at the WHO diseases prevalence in this area, after malaria, it's actually GI disorders. So I think this is a very, very important division for this. And for him to make the right diagnosis.
That's great. Just about a word about a doctor himself. He's the one of the topmost gastroenterologists in the country.
Wow.
And we will be very lucky to have him with us.
Thank you. Thank you. Healthcare hero.
I'm excited to begin this work now.
Yes.
Thank you. You're a healthcare hero.
You're late, so you can begin today.
That's great. That's great. And now we're going to come back to our studio and send it back to London before we do closing. Thank you, and back to you, London.
Assalamu alaikum, welcome back. Here we are in the HFI studios, driving your interests, scanning everyone to see how they are being impacted in excitement by all of this amazing footage. You're hearing all of these incredible stories talking about who's been involved. And I understand we have a guest with us now here. Is that right?
I hope we've got our chairman from Canada, because our Canadian donors have. We're still waiting we have had donors from Canada, UK, and even Australia. Our medical association in the UK have done a lot of work helping us. Our medical association in Australia helped us in the beginning quite a lot with funding, and they've been looking at donated equipment. So I am hoping that we can speak to Dr. Russell, our chairman in Canada. But again, what you saw there is, for example, in the endoscopy unit, they have what they call endoscopy tower, and you can get additional scope, so you can look not just down your throat, through your intestines, upper GI, lower GI, as they describe. It helps you to find, early signs of cancer, and then you send those samples to our biochemistry lab. We've got a laboratory in the hospital to look at those chemistry samples, and then the quicker we can spot conditions, the higher the chance that we can treat them, and at lower cost and lower pain for the patient. And this is a repeating story around Africa. So that endoscopy unit is so critical. It's great to see the X-ray unit taking shape. What people didn't see is that, it looks like in order to contain the radioactive waves coming out. And if it was a CT or an MRI, it's even worse. Then you have to have a certain level of shielding to prevent electromagnetic radiation going out. In the design of a hospital, they have what they call adjacency. So if you have an X-ray room, you're still going to get a little bit of leak of X-rays even through the shielding. So you don't have a clinic for little children next door. You don't want to fry them.
Well, I think all of this is resonating with our viewers. This is probably a good juncture to point out that we're now up to $45,000.
Wow,
so
that's excellent.
Really big thank you. May God bless all of you who have continued to support such an incredible project. I would strongly encourage everyone to, continue supporting us, continue trying to help out such a blessed initiative. I mean, what really stuck out to me was earlier when he said that constructing hospitals are second only to building nuclear facilities. I mean, that's extraordinary. I had no idea. I mean, just watching obviously what they've been doing so far, it seems complicated enough. But I mean, up there with nuclear facilities. And again, what was said earlier, for the people, by the people. I mean, these are some of the blessed initiatives. There is good in this world for those who wish to be a part of it, who wish to contribute to it, who wish to support it. And if you can't be there on the ground lifting the bamboo poles for one, right? Then you still can be a part of this blessed initiative by contributing to it. I mean, you talked a little bit about some of the sponsorship levels, and that's if you'd like to have your name there, or you can dedicate it in the name of a loved one, of course, or you can do so anonymously. And I think any amount is perfectly blessed. So, I mean, if the sponsorship levels, maybe Fazil, you talk us a little bit about those sponsorship levels. I believe they start at around 1,000.
So in the UK, £1,000 is the starting point. That's the bronze level. Goes all the way up to diamond, which is 10,000. And depending on how much you donate, you will, for any donation above 1,000, you will get the name of either yourself or a loved one or a business, whatever you would like on there. And the prominence will go depending on how much of a donation you make. So we are going to have a donor wall in the hospital, which is going to be a permanent feature. But coming back to the sustainability of the hospital, it's not just the quality of the facility, we're teaching hospital. So for the surrounding communities and for the country, in fact, training other clinicians. So that's going to leave a lasting legacy for the country. And we're going to have visiting clinicians from the UK, from Canada, who in their specialty will be training on the latest methods back into Cote d'Ivoire. And this is just one example. You know, as I said, we've got people watching in from other countries nearby, in Benin, in Togo, in Mali, in Gambia, where again we're training, we're investing in capacity building in Africa, we're investing in equipment, and all of these countries need the same. So we have our team in Latrikunda, and in Latrikunda in Gambia, we've been assisting both the dental hospital there and the general hospital there. In South Africa, recently we were in Rivier near Khayelitsha. I was there 2 weeks ago, and we're about to go into partnership for cataract surgery.
All right.
So this is an ongoing process that we're looking at throughout Africa.
Now you've been part of this project for I suppose its inception, if I'm not mistaken. And one of the things that I think strikes me as interesting watching the folks who are taking us through a tour of the facilities, and you see a lot of these same faces, these people who have been involved, like yourself, from the very beginning. But you know, I suppose some of our supporters would like to know, like, we're here trying to encourage people to go ahead and support this blessed project. But like, given that you've been involved from the very beginning, why have you been involved? I mean, what motivates you to take part of this project?
It's part of our faith. It's half of our faith. And actually, when you see the impact on, this is why I talked about training and capacity building, because when we train clinicians, it leaves a lasting tail. Whereas if you have, say, someone going for 2 weeks from the UK, for 2 weeks they can do something good, but then they're back in London. Or
yeah, but
Frankfurt.
that's wonderful. But why you? What makes you get up in the morning and hear about a project, you know, about a hospital project being built? What motivates you to say, well, actually, I want to be a part of that. I need to be a part of that. In fact, I think let's put that on pause. I'll give you a pass for right now. Let's put that on pause. Don't worry, I'm going to hold him to it because we see him all the time talking about this project. But I believe we have Dr. Dawood, Dr. Asif Dawood on the line with us. Assalamu alaikum, Dr. Dawood.
It's wonderful. It's a bright sunny morning. We are in Majlis Shura of the Jamaat, and I've just taken some leave to join in this call. I understand that it's going very well.
Right? Because of your wonderful entrance into our call. Firstly, you know, I think I'm going to save the best question for last, right? Just in case, so that'll give you a way out in case you're trying to escape as well. But maybe take us through how Canada has been involved thus far.
You mean with the Ivory Coast Hospital, right?
That's right, absolutely.
So it started with one day, all of a sudden, I got a call from our international chairman, Mr. Ahmed Yahya Sahab, and he said that Huzur has approved that Humanity First Canada will be involved in this project along with Humanity First UK. And he asked me if I can do $1 million for this project. And I said, if it's Huzur has said, then who am I to question that? I'm going to be, of course, I mean, we'll do that. So that was the humble beginning of this program. And then we launched this campaign with the help of information from Majid Saab and others. We promoted this event, and there was a very warm response from the community and from our donors. And within a few months, we were able to get a good number of pledges to support various facilities and spaces of the hospital. And by the grace of Allah, the commitment that we made, out of that, we have already collected about $1.4 million, which includes a sponsorship of some of the key areas in there. It's a long list of area spaces or facilities that Canadian donors have sponsored.
And what type of sponsors have you found coming across, your experience?
So we have three types of sponsors, basically. One, individual donors who have a passion to support humanity first. They have come forward and they regularly donate certain amount, or they have donated one substantial donation for a certain project. The second is a group of family members, like a few brothers or a husband, wife, and children. They have come forward to sponsor. And the third category is some businesses who have taken on themselves to sponsor certain facilities in the name of business. So, for example, a donor chose to sponsor the emergency block. Another donor said that we're going to sponsor maternity suite. We have a third sponsor who has sponsored Operation Theater. And one passionate brothers, there are four brothers who said that a pharmacy has to be in our mother's name, and we are going to support the pharmacy. So those four brothers together have sponsored the pharmacy over there. And we have other sponsors who have sponsored specialist clinics or VIP rooms or common areas that has been sponsored. So again, there are three different types of sponsors that we have been able to get.
Awesome. And have you been there so far to the location?
Yeah, I was at the foundation laying ceremony, and I was fortunate and lucky when actually I was honored to put one of the bricks in the foundation time. But I'm so excited and looking forward to go there as soon as it starts functioning. So hopefully this September, I'm understanding. So not only myself, but there's all our donors and other volunteers are looking forward to be there, to be present at the inaugural ceremony.
I was going to say it's not just the clinical side. Even I think a couple of the people with dry cleaning businesses in Canada sponsored the laundry and housekeeping. So it takes all aspects of the hospital to make it work.
Yes, we have a donor in Calgary who has got a dry cleaning business, and he said that he's going to support the laundry, and he donated. I mean, he not only worked hard to raise money for our facility for the hospital, but he's got business named Dolphin Dry Cleaners, and then he sponsored the laundry also over there.
All right, one last question.
Yes.
Because I think we can still keep you on the hook. Why is this project personally important to you?
It is very, see, the Humanity First started with the one first and foremost requirement is the saving lives. That was when we were doing disaster response, or when still we are doing our disaster response missions, the first priority is to save lives, and then we go into other areas of emergency support and food security and water and other things. So having a healthcare facility or providing basic healthcare in a high quality way, which is not normally available in third world countries and especially in underdeveloped areas, will change the game there. I mean, having healthy communities who are working, who know that there is some support available makes a huge difference in the community. I think the first and foremost responsibility is to save lives and relieve the human suffering. So it is very important. It's personally dear to me because of my background in medical profession, and I've been there. I've seen that area where there is a lack of such facility there. So it is very, very dear. And this is the second hospital that we're supporting. We have one in Senegal, which is by the grace of Allah running very smoothly and helping a lot of people. We have seen the benefit of that and how it has impacted the local community. So definitely, this is a project very dear to us.
Well, thank you so much.
So I was going to say, first of all, thank you to all of our amazing donors in Canada who always come forward when we need them. As hopefully they've been seeing, the hospital is very close to going live. we're recruiting staff, we're getting the last equipment in, and we need their support in the next month. So if our friends in Canada could maximize, any size of donation, $50, $100, whatever you can do. If you want to do something bigger, there's still rooms to sponsor, please contact Dr. Dawood Saab and his team. And we look forward to welcoming some of your team to Yopougon in 3 or 4 months' time when we open the doors.
Inshallah ta'ala. Looking forward to it.
Jazakallah, Dr. Saab.
Jazakallah, Dr. Saab.
Jazakallah.
So I think we're now going back to the team in Yopougon.
To the Masroor Health Center. As we come back together, we've walked through the entire facility. We've seen from the two entry points to the various operating theaters, to the hallways, to the solar. There's a lot going on. How can people help? We understand the challenge. We understand the need. Where can people help here?
Okay, I think first I will just share quickly that the tour was very impressive. The high quality of work that we saw and the efficiency that Majid Saab brought into this project from cost perspective. And then, basically it's an honor to present such a high quality, beautiful gift to the people of Côte d'Ivoire, right? I think from that perspective, it was very impressive. And then the need that we talked about, throughout Dr. Coulibaly talked about and other people talked about, the need is there for this type of hospital, the quality hospital. So I think our membership should understand that there is a need, and obviously this was guidance of Azur as well, to build this hospital to serve the people here. So I think this project was given to HFUK, but then as you heard from Dawood Saab from Canada and HFI, these three entities are working together to build and pay for this cost of this hospital. And USA as such is not involved in that funding program. USA is involved as far as through Majid Saab's healthcare services to manage and run it. But today I will pledge $5,000, Fazal is listening, from HFUK as a token. I mean, that's not a big amount, but as a token just for today, I'd like.
Just to be clear,
right?
You see the value now. Now, how the funding mechanism worked, as outlined by Azur Eidallah Ta'ala bin Nasir Aziz, is every country works on different projects, and so therefore, Humanity First USA has been working on other projects and funding those. And despite that,
right,
you're helping to, as you see the value, you see the impact, you're investing in this hospital as well.
Absolutely, and with that also, I think our physicians from USA will be supporting Majid Saab and Dr. Saab here as a team to support. I think doctors from all countries will come here, but that will be our contribution. But I urge members, every part of the world, that this is the next project to complete. We have more on the line, but let's get it finished.
So we've got 3-4 months left.
Right.
June, July, August, September, and we want to be able to serve patients. We want to be able to make an impact, change lives. You saw the need for gastroenterology. You saw the need and a growing community for the maternity ward. We want to bring this live, and this is not an idea.
Right.
This has actually been connected. Dr. Fahim Saab, how do we tell folks who do not have a medical background that this type of work matters?
You have to imagine yourself living in Côte d'Ivoire. If people are sitting in Canada or sitting in the UK, just imagine that from a quality healthcare, you are 200 miles away, 2 days away. You're living in Benin, you're living in Mali, and you do not have that care. Either you are sick or your loved one is sick. And just imagine the difference that you can make in somebody's life when they walk in through these doors. And ultimately, I think the goal has to be that this area becomes the center of excellence for healthcare, as you expect in your own background where you are sitting in highly developed nations. So this is the chance for us sitting in those countries, either in USA, UK, Canada, or anywhere else in the world, to put in our part. And that does not mean that people from this country do not participate, but obviously I think the onus is more on people who have those kind of things available. So I would say, put yourself in Abidjan, Cote d'Ivoire, and then think about the healthcare that you can provide that you usually are accustomed to get.
You know, I caught a bit of a bug last night, and the way you helped me was out of this world. And what I saw is that, you know, what in the US we call healthcare heroes, because the impact they make is beyond money. The impact they make, it really comes from the heart. You know, you opened up your bag, and your mother packed you some certain homeopathic medicines, and you had certain others. You made a cocktail, and alhamdulillah, feeling better. What do you think about the staff as you staff this location? Are we going to be able to attract world-class individuals?
The staff has to be local. They have to have ownership. Of course, the guidance will have to be initially provided under the leadership of Mr. Majid Khan as he runs this place, and the medical directors that are there. But ultimately, Dr. Ahmed and his team and other local staff have to run this place. But as I said in the first segment, we have to get the staff that buys into the Humanity First vision. And the screening of the staff is very, very important. Humanity First vision is very different than a private hospital that is working in Cote d'Ivoire here across the street. So we have to be able to get somebody who is going to share in our vision to provide affordable but quality healthcare at the right time.
That's really helpful. Majid Khan Sahab, I think after walking through this facility, at least I can speak for myself and probably everyone who's physically here, and perhaps some who have seen on the screen, that this is an incredible facility. It's learned from the lessons of Guatemala, where there's another incredible facility that has been expanded, and the need was clear. We're serving more individuals, so who's going to come? We are breaking even and beyond in terms of the dollars we're raising from a sliding scale of customers, patients, to helping the needy. And so we understand the model from what I understand very well. As you come here, help paint the future for me. Help me understand what this looks like 5 years from now, and the hub and spoke model. We're in between 4 other countries. There's a lot of value in a strategic location here.
So, if you allow me, let me first begin with what Monem Saab said earlier. He didn't have to, but he announced $5,000 as a token of sort of appreciation for this project on behalf of Humanity First USA. Taking from whatever his initiative, I'm going to request every chairman of Humanity First USA globally to give some kind of token support as a Sadqa Jariya. We have Amit Saab, Ivory Coast here. I will start with him. That if on behalf of his Jamaat, on behalf of Humanity First Ivory Coast, if they want to put in something as Sadqa Jariya, also anyone sitting here or listening to this anywhere in the world, please come forward, even $5. Just be part of this initiative, because coming back to your question, because
I have a right to my question. You have a right to your answer.
Yeah.
So I understand the fundraising urgency, but the reason I asked that question was to help us, as we all invest, help us see what that will do 5 years from now.
So if we take this template 5 years ago, what Nasser Hospital was doing is obviously as soon as we inaugurated the hospital, COVID hit us. So COVID, everything went down, everything. But we converted that into an opportunity And suddenly we were doing much more than what we were supposed to be doing at that stage of our growth. So at this moment, Nasser Hospital is not only sustaining itself, it is developing. It is becoming a regional center of excellence, and it may actually one day be the hospital in Central America. This is the vision we should have, at least for this hospital. As we discussed before, this is strategically located at a place where we can have number of satellite clinics to support this. This can be a completely game changer. Again, this telethon is not only for fundraising of a hospital. This HF Healthcare is a movement now. A movement which started in Central America and coming to West Africa, and as we'll go into the next section, we may even go to the other parts of Africa. So this movement we are creating and giving to the world an alternate healthcare system. Quality, affordable healthcare, which no other interest but to help the people and giving them something which they and their next generations will be benefiting from.
So that, and I really appreciate the vision, and we'll bridge it back to the funds needed to achieve that vision. But in this vision, you have proven that it works at the Nasser Hospital. Now that we come to the Masroor Hospital here, or center here, and all the groundwork is laid, the project is up and running. Help me frame the need for me in, let's say, US dollars or pounds, however you want to say it. Looks like Canada raised 1.4 million, probably Canadian dollars. How much have we raised? What's the delta? Well, and then we can talk about how many individuals can participate.
Yeah, very important. I'm glad you asked this question. We started in 2021 with a budget of $3.8 million. It is 2026, and we are still at $3.8 million, which is unbelievable. I would just call it ke Allah ka fazal. Without his help, it was not possible. You go back to your grocery bill, just see from 2021.
Yeah.
And you see now, how much has it gone up? We are still within budget. So as per the aim was 3.8 million. We now have 3.3 million. So we are still $500,000 short. This is to open the doors for the patients. But the work is not completed or finished when you open the doors. It starts. So, and you don't expect your hospital to be sustainable the moment you open the doors. It takes a couple of years. But once you are sustainable, then you can generate enough funds, not only to operate, but also to help those underprivileged who have no other place to go.
And give back. That's incredible. That's a great framing. $500,000 and plus more. I think we're tight on time, and we're grateful for Humanity First USA for going beyond what was asked of Humanity First USA, and to Dr. Fahim Ahmedzai for all the expertise and thoughtfulness and innovation you're bringing to this facility and every facility, and Majid Khan Saab for you to bring this thing on budget and deliver another great hospital, one of many in the future, inshallah. May Allah be your reward for each and every one of you. We are here in Côte d'Ivoire, where you've seen what we have. You've seen when we're launching in September, and we invite you to join us on this journey, gain the blessings, and to build something that will help thousands, if not millions of people in the future. Thank you for joining us, and we're signing off from Côte d'Ivoire.
Assalamu alaikum. So we've been listening to Q&A in Yopougon in our new hospital, and to all of our team there, l'équipe de Humanity First Côte d'Ivoire, merci beaucoup. We look forward to seeing the operationalizing of our hospital. But providing medical facilities is only half the story. Many of the patients who will end up in hospitals in Cote d'Ivoire and surrounding countries like Mali and Ghana are there because of water-related issues and malaria. Many of them will be there because of food security-related issues. And so Humanity First is also working, whether it's in a Bengaluru or Man or Senamatiali across the country, on water installations, on farming projects. Now, farming-wise and food security, in 2 or 3 weeks' time, we will be actively working on the Grabani campaign, and the sooner we have funds, the cheaper it is to procure the animals. So I would ask our donors to please be ready to make their donations this week so that we can get the animals at the best price. Last year, we reached 1.1 million people in 74 countries. This year, we have an even steeper ambition. But this is just part of the story. We're also doing farming projects and we're doing water installations. And actually, the combination of these projects keep people out of hospital. But as with our hospital in Guatemala, we won't just be treating patients, we'll be providing them with guidance on nutrition, like we do in Guatemala, to improve the lifestyles and wellness of our patients and hope that they don't have to keep coming to our hospital. So I think we're now ready to speak to Dr. Musa. We saw earlier the dental unit in the new hospital. We mentioned that one of our colleagues from Belgium is assisting with that. I'm hoping he's now on the line. Dr. Musa? Musa Saab, are you on the line? I think you're on mute. Musa Saab, can you unmute? So just while we're waiting for the technical connection to work, Dr. Musa decided to support us. He is a dentist from Belgium. He visited and he's kindly helped. He's investing and he's helping to make this a state-of-the-art dental facility in our new hospital. Musa, are you there?
All right. Well,
We're still waiting.
While we're waiting. Oh, wait a minute. Looks like he's back.
Dr. Musa, can you hear us? A good connection to Cote d'Ivoire. We're struggling with Belgium. Wa alaikum salam. Yes, we can hear you. We can hear you.
Okay, so thank you for having me. I'm Musa, and I would like to thank you for giving me the time. And just please, I'm all ears.
So you heard about the hospital. You are a dentist in Belgium, and I believe you visited our hospital in Yopougon-Jesco.
Yes, I'm Musa. I'm dentist in Belgium, and together with my wife, we run a dental clinic here. And we had an opportunity last year to visit the hospital, and it was a really wonderful experience there. At that time, the roof was almost finished, and then Bajisa was busy with the details actually, and it was a really wonderful experience. One of its type that takes place in this part of Africa. The structure that you see, the quality of work that is delivered, and I believe that it was really ensuring for everybody, for us as well, that all of the project is in a really good hands, and everybody that is involved, they really takes care of the things that are going on there.
And you're going to keep investing in the equipment in the dental unit, yes?
So we have got the chance to work for a dental clinic there. So equipment is one small part, and then the real part is is to establish a sustainable, trustworthy, and ethical dental service. It includes the training of the local staff, collaborating with the local dentists, and also creating the safe, repeatable treatment protocols. Also networking with the dental labs. They are very important as well for for constructing different type of dental prosthetics and dental solutions. So I believe that inshallah we got the opportunity to keep on working in this regards.
And you have the advantage, vous parlez français.
So in Belgium, it's bilingual. Myself, I'm not very much fluent in French, but it's not very unknown to me. My wife, she's well bilingual, so she can certainly help in French. Yes.
Very good. And I think the Sadqa Jariya part will be not just the patients that you help us treat in the hospital, but the more people locally that you train to a high standard, that will have a lasting impact in Côte d'Ivoire.
I think that's the key for a sustainable clinic and a sustainable hospital, that the local staff that are present 24 hours by the way of speaking. If we can get them trained, then we can provide continuous services, and also there's a possibility for expansion in the local region as well, and maybe in other countries. But I think that in this region, the hospital provides us has a very strong headquarters, a very strong base for such ventures.
So Jazakallah for your support, and I hope this is giving an example to other clinicians who could also help, not just going for short periods and doing clinical work, but as Dr. Musa said, the clinical capacity building, the training will leave a lasting legacy, not just for our clinicians in our hospital, but for other clinicians in other surrounding clinics and hospitals. So we look forward to seeing you later this year in Côte d'Ivoire, Dr. Musa Sahab.
Inshallah. Thank you for your time. Assalamu alaikum warahmatullah.
Jazakallah. So, Hamza, to finish off.
I mean, it's so inspiring, this entire program. I want to paint a picture for everyone. So we've sat here the last 2 hours and 20 minutes, and we've heard stories of volunteers. We've heard stories of chairmen, workers, engineers, tons and tons of health professionals, even day-to-day volunteers who do nothing but contribute their time or contribute their money. And what's interesting is that we first heard of this idea some 10 years ago, and we saw the beautiful computer-generated plans, right? We saw raw pictures of the land that this vision would finally find a home. And here it is 10 years later, and what's amazing about it is 3.3 million pounds later, which is a miracle in itself. Everyone has heard of scope creep, right? Even if you're just trying to do a loft conversion or something in your home, everyone knows that even these simple projects start out with one quote, and where you land is often very, very different. So that in itself is a miracle. But we've seen the drone footage. We saw the interviews. They gave us the walkthrough. And now, in a few months' time, in September, there will be the grand opening. And so for those of you who have supported this project from the very beginning, and for those of you who have been listening and hearing about this project, attending the telethons. To all of you, we say, help us now complete this project. Let's bring it home. These are the last few months. We heard that we have what? £500,000. By the grace of God, today so far, we've got £55,000. But I think that this is just the beginning. Not only the beginning of meeting that goal of £500,000 with each and every one of your help, be it little or be it much, be it £50, £250, £1,000, £10,000, whatever it is, whether you are doing it because you want to dedicate that donation to a loved one, a family member, or whether, like some of the other sponsors, you have families, people who say, let us contribute to this, parents and children, or maybe it is that you wish to donate the equipment. Whatever is your motivation, think about not only the little bit of time that it takes you to donate whatever amount you have to help get this over the line. Just think about years from now, where somebody will say, my father helped build that hospital in the Ivory Coast. My mother helped build that hospital in the Ivory Coast. My grandparents helped build that hospital in the Ivory Coast. Because things like cars and all of the other things, they come and go. But noble investments like this, they keep on just sort of generating goodwill and help for all of humanity, for the people in Côte d'Ivoire, from the people who will come from outside of Côte d'Ivoire, and also for you and your own families. We need your help. Simply put, let us help get this hospital open. This is no longer just a couple of architectural drawings. This is reality, as you have now seen. So I hope and I pray that this will be a blessed project, not only for those of us who are able to go and see it, but also for every single one of you who have subscribed, who have sent in your donations, and continue to send in those donations, little or much. Every single one of you who is watching this program and says, this is a beautiful thing. This is an amazing thing, and I wish to be a part of it. I wish my parents and my children to be a part of it. So to all of you who are trying to be a part of it, we thank you. And for those of you who cannot be a part of it, we say God bless you and thank you and keep us in your prayers. And on that note, I will ask you, Fazil, to lead us in silent prayer, that may God make this endeavor a source of blessing for all of those involved, for all of those there in Côte d'Ivoire who will take benefit from this, and also for those who could not take part of this, but who helped us with their prayers.
Okay, please join me in a silent prayer. Ameen. Okay, Jazakallah to all of our donors, and please keep supporting us, and Assalamu alaikum.